had to call my mom. I just said like, okay, like I'm tired. yeah, lender who have refused to do business with us.
No, we don't take help.
Money.
Yeah, my name is Dr. Are Abdul Hafiz. I'm a medical doctor first. I'm a medical doctor. My specialty is e-health. I started a bit with cardiology, but had to move to health IT. Basically, I saw a need in the healthcare space, and I decided to solve that problem, and that's how I became a founder of Primed eHealth. So Primed eHealth is simplifying access to healthcare, changing the fact that most patients always have to wait a long queue of be very inconvenient just to get well. So what Primed is doing is to ensure that healthcare access can be simpler, easier to achieve using technology, and also improving I think the methodology used by healthcare providers themselves. And lastly, we're then connecting the providers and then making sure that the healthcare consumers can actually access them at their own convenience.
So I think for us, it's really just about value. Yes, we have lots of competitors, but then we're able to look at the existing problems in the healthcare space, especially in Africa, and build solutions to address these issues. Currently, I would say that we're one of the first to ensure that patients have easy access to their medical records. This is something that a lot of African countries currently lack, and we were able to achieve this in Nigeria first, of course, and then with other plans to scale this across Africa. All right, so currently we have a hospital management platform. We launched a patient application as well to ensure that patients can easily connect with their hospitals, regardless of time, regardless of location as well. Of course, as they go through their medical journeys, they have their health records saved on the platforms, and this can also be used in their current hospital, or even if they decide to move from that hospital to another hospital, you can still have access to that on the platform. So basically what we're trying to achieve is just health share record across multiple facilities, which Africa is currently lacking.
Yeah, so initially, the most important challenge was, in fact, the traditional belief and mindset that healthcare providers, doctors, nurses have. They want to do it the old way, and they do not want to change. So that was the hardest thing to change, and that took time and years to convince them that there's still another way to do it. That was the first one. The second one was that when they were not willing to change infrastructure, the absence of whether it's internet infrastructure, power infrastructure was really a problem. And then funding was probably the icing on the cake, because at the end of the day, even after we got the buy-in and we got some infrastructure, scaling this infrastructure was then a challenge. And then over the years, we had to now do them a hospital. So that means one provider after another, one hospital after another, until we were able to create a chain of hospitals that now had a certain level of infrastructure that could actually allow patients now connect with them, and then we can achieve either data connectivity, data share, and so on and so forth. So.
Okay, so I would say that we started off with one city in Nigeria, and I'll say currently we're currently operating in over 7 cities in Nigeria now. We have over 35 hospitals, across Nigeria, and I would say that's really good. I believe in terms of revenue as well, we keep doubling our numbers year to year. So I think that's very good progress for us, and we plan to do so much more.
I won't say it was online. I think there's a way Baba just comes to your feed, and they're always on my feed, and I'm like, we won't take external investment until we're sure that healthcare was, the people within healthcare were ready to have other players to support and grow that space. But after seeing them on the feed, I just said, okay, I'll just do an application. So that was probably our first real application with an African-based accelerator. And then after that, there was a call from Art, and then I realized that they probably had more passion about what we're trying to do than us. And at that time, it was a feat, even though that. So I'll leave my initial fears, basic, because as I said, the main problem was infrastructure, financing, and I knew that for an African accelerator to be able to support such myriad of problems was going to be. But at the end of the day, I realized they brought in quality, they brought in the simplicity in breaking complex problems, starting from something. So that changed the way we could solve things and was the beginning of some very big things. Thank you. If it's just because of money, it might not be the best fit. But if it's to find a structure that you can scale, then yes, it will be the best fit. And for me, it will be that once you get the structure right, then you can always expand the structure. So even when Baobab can always support with introductions to other those that really have funding, whether it's the VCs, whether it's the angel capital, angel investors and all of the private equity. And then once it's done, you can then scale it. So that's the first thing I think, and the most important thing I think founders will get. And they bring you down to earth, and then you find your own metrics that you can grow, and then you can start growing that.
I'd say for me, it's what people just care about is to add value, and that's what we try to do as much as possible. So it's either you're 0 or you're 100. You cannot be in between. So we don't try to manage, we don't try to do all of that. We try to just be excellent at what we do, and the whole purpose, because it's healthcare also, so it's very, very critical. We're attending to the needs of patients, the lives of people as well at stake, and so we try to be as excellent as possible, very thorough at what we do. So I think for me that's it. How about you?
I'll say that what I learned is that it might take 9 years or 10 years to create value, but it takes 1 day to break even, especially when you are in the social enterprise space. So what I would pick up the most is that, yes, we might have spent more money developing the sector or the space than we got from the space. So for other investors, they will look like, are you sure you're making enough money? Don't you think you're spending more money? But what I think is that if we don't spend money and create value, or we can't wait for governments, actually for Africa, to create this value. So we have to sometimes spend some of this money we get, whether it's external financing, whether it's internal financing, which is what we've been doing. But what it does is that it creates a certain value, and then other people see this value and say, what do you need? So that's what I've learned. It probably just took 2 days, and what we've gotten in the last 2 weeks, where everybody being amazed at what we've been able to build, even though we don't think it's that big, but they all think it's that big, and then they're saying, how much do you need? What do you need? So they don't even need equity. They just want to say, if this creates value, then you can do this across Africa. This is gold. So it means that we just have to stay the course, and then we probably then yield results at the end of the day once we're creating value. So for me, I think I can count 2 L's. Yeah. 1 L was after giving 6 years in Abuja, that's the first city we started, which is the capital, and giving to more than 6 hospitals, 6 of the city hospitals. The feedback from the government was that we don't believe we need to put money to maintain and sustain this. And the thing with healthcare or infrastructure is that infrastructure is expensive, technology is expensive, but not being able to sell that vision, that concept to the government means that even after giving a lot to the public hospital, we can scale, we can expand, and then it becomes very limited. That's actually the reason why I left Abuja. That's why I said, okay, you know what, let's start doing something new in Lagos, let's start going to other cities. The second one will be, now we're getting to Lagos and now giving so much to public sector, public hospitals, because that's where the poorest of the poorest probably go to. You spend so much money, invest a lot, and after 1 year, the hospital says, you know what, we cannot use your software. We don't think the software. And the challenge is that they don't have good power. They don't. So even if when you give them inverters, the power go down. So at the end of the day, realizing that the owners of the hospitals don't even take ownership, even after we've given them that technology, it sometimes demoralizes you, and that's probably one of my lowest. I hate to lose clients, and probably never did. So that was probably it.
It's very, very similar because I know what it takes to really get the hospitals on board. It takes a lot. Lots of visits, presentations, and all of that. For a hospital to just say, I want to quit, then of course we're worried about that. And when this happened, it didn't just affect Dr. and myself as well. I felt like, oh, why? We tried to have a couple of meetings with them, but to see that okay, it wasn't really a software issue. It wasn't really, that we didn't do what we were supposed to do right. But of course, lots of issues with infrastructure. So these are some of the things, that could hinder or that could be a challenge to, building something this beautiful. But yeah, then we learn from these experiences.
Yeah, I'll add something. So at that time it was else. So as I said, if you don't have the right team or you don't have the right partner, you sometimes can get overwhelmed and just say, you know what, I'm not quitting, but I'm going to quit on certain things. There's certain hospitals or clients I won't take. I'm just going to focus on the big private hospital or the big client that pay a lot. But we did not. But what we did was that we then doubled down and said, you know what, we'll do it again. And then we made more investment on the other public facilities. And what it led to was that it led to us getting, as I said, acknowledgement from those that provide infrastructure in such a way that now it was the Secretary of State of Abuja, the FCT, that called 3 days ago, just 3 days ago, and called with the DG of healthcare and said, you know what, Dr. The 6 hospitals, we want you to come, tell us what you need. We know that your problem was money. Is it not money? I said, yes. Okay, please can you come to Abuja on Wednesday and make a 2-hour presentation, tell us all you need so that you can get all of these things. It was so amazing, and it made, and meanwhile we've been supporting the hospitals without collecting anything. So it gave that, it reassured and said, look, we're on the right track, and yeah, that was amazing.
They saw the impact, they saw the value.
Yeah.
Actually, I've just thought about it. You guys are some of the few that actually work in the public sector space because it's complex. So maybe just share with us what some of the things that you've really learned around working in public sector and how to make that a profitable space, considering some of the things you're doing actually government responsibilities.
Wow.
Okay, I would say it's very profitable because you find majority of the country's population would actually visit more of the public hospitals. Of course, it's challenging as well because it has to do with government. So you're going through different stages before you can even have an agreement or a presentation or signed MOUs with them. You have a couple of people to actually talk to. So doing anything with business, it takes the public sector. It takes a lot of patience as well. But know exactly what you need to do. Know the value that you're bringing to the table. Understand that you have to talk to the decision makers. So you need a lot of people, but what matters is, for us, it's, okay, who is the Minister of Health? Who is in charge of this? Who makes the final decision? If you get to that phase, just ensure that you deliver your project or your service excellently well, and then it becomes very profitable because of, we find majority there. So I think that's my advice.
I think what I'll add there is that it's also not to get too carried away, because yes, there are numbers, we have a lot of numbers in the public space, but at the end of the day, to also have a plan to monetize. If you might not monetize immediately, you do your social value, create the value, but at the end of the day, there must be a plan to monetize. And if possible, like what we're trying to do now, you probably want to have another team, a separate team that will be in charge of monetization. But one of the cardinal points for those that will work with the public space, which is where the majority of most citizens are, is that it's a lot of social networking. So you don't just sell. I think for me it will be to share the fact that it shouldn't always be about funding. I know that's a cliche, but it shouldn't just be about fundraising. We should probably focus more on creating a value, and the easiest value to create is traction. The best traction to create is from those around you. So whether we're in social enterprise, whether we're in fintech, just ensure that your mom is using your fintech product, or she agrees to use it. Your dad will use it, or your cousin will use it, or your neighbor. It's easier to do that, or the school you finish from, because once you can get those around you to accept to use your, or they give you validation, and that validation begets another validation at the end of the day. So for me, it will be that we should focus on our local community, our locals, before we go online and try and get 1 million users to sell. So let's probably focus on creating value, and then hopefully, as I said, naturally value will be monetized when it's time to monetize. Thank you.
Okay, for Pri-Med, I think we've done a very good job bringing the hospitals on our platform, and right now focusing on the patients. But the future of Pri-Med is to create a marketplace for healthcare. So we plan to bring the pharmacies on board, we plan to bring the laboratories on board. You know, we're trying to bring the other smaller clinics, you know, on board as well. We're trying to bring private doctors that probably do not have, you know, the funding to set up structures, you know, to establish hospitals. So we're trying to create virtual clinics for them where they could still connect with their patients, and of course, patients also have access to care through that particular platform. So yeah, that's the Pri-Med.
So the global future of Pri-Med, which will start in June, will be that Pri-Med will also be pioneering healthcare expansion and access, not just for the African market, but basically for the diaspora market. We'll most likely very soon be partnering with Visio to create a community between the US and Africa, where not just Black founders, but just doctors. As I said, there's power and there's numbers with the Blacks. We have to be proud to be Black, we have to be proud to be Africans, or to even have African descent. So what Pri-Med is going to be doing, or what we're already, we're almost, as I said, by June there will be a launch, is that we're going to launch a product that would connect Africans anywhere you are, anywhere they are, to both the providers, whether they're hospitals, whether they're doctors, whether you need genomics, whether you need infrastructure. Pri-Med will also be providing infrastructure support to hospitals wherever you are. We would also ensure that, as I said, the most important thing is to empower the doctors, empower the hospitals, and then empower the patient. So we want to create a space where people can live well and can stay healthy. And when they are down, we will also help to uplift them. This won't just be Nigeria, this won't just be Africa, this will be worldwide. Thank you.